Well, we are in that beautiful cool weather season in Florida, but that also means it's flu season. And there are plenty of flu viruses going around out there this year in particular.
Right, plenty of viruses in general. So guess what we did? We decided to talk flu and call in our house doctor, Dr. Patrick Mularoni with Johns Hopkins All Children's Hospital. Let's dive in. So many misconceptions, so many things we want to ask you. First and foremost, flu. Colds. Let's talk differences. Does it have anything to do with, of course, the weather being a little chillier here?
It actually does. No, it does. Maybe not here in Florida, but up north it definitely does, because the flu virus, we know that the flu virus in cold weather it transfers easier, and in low humidity it transfers easier. But you're questioning, like, wait a minute, when it's cold up north, it's actually humid when it's cold up north. But what happens is people are inside their house, they're running the heater inside their house, which dries out their house. So then you have a dry environment. It's cold outside, people aren't doing outside activities, so they're staying inside. So you've got people huddled together in dry environments, they spread the flu. Now, obviously here in Florida we have better weather, but we also have a lot of those people coming down here to visit, and the flu can spread.
Well, speaking of the flu spreading, I'm going to speak from personal experience. I am one of those households that got hit with the flu, and we think it's weird because it traveled through part of the household, but not everybody got it. My younger daughter definitely had it. She had flu A. So what is the difference? My first question, what's the difference between flu A and flu B? And in general, how do you keep from transmitting those germs?
Yeah.
So a lot of people get caught up on flu A or flu B, but really they're both going to make you sick, and they both transfer pretty well to anybody. So I don't pay a ton of attention to that. It's really, the flu is the flu. And with the flu, everyone's going to get different symptoms, right? Some people may have, you're going to have fever and body aches and just not feel well, runny nose and cough. Some people will have diarrhea. Some children will have vomiting. The symptoms definitely vary. Your question of how do you stop it? I think that
how did I dodge that?
Right, exactly. Right? Well, the one thing is immunity, right? If you've seen the flu, every year we see a different variant of the flu, and if you've seen a variant like that, or your immune system can protect you against that variant or something like it. That's why every single year you should get the flu shot. And even though you might see on the news that, well, the flu shot's not perfect this year, it still gives you a booster and exposes you to flu virus, which they're all the flu. So it can help you, definitely. But the most important thing is you need to wash your hands. Most people think that you're going to catch the flu because somebody sneezes and you walked through it. And although that can happen, a lot of times you catch the flu because you touch a surface that somebody else who had the flu touched. Now you have the flu virus on your hands and you wipe your eyes. Yes, it can go through the mucosa in your eyes. That's one of the most common places for you to get it. It can go through your nose as well, but often we're rubbing our eyes and we're doing that with dirty hands. And so making sure you wash your hands often, especially if somebody around you is sick.
The question, like you were saying, the flu A, the flu B, Daviana was affected. I mean, it's one of those, like, to get that diagnosis, to get that confirmation, you have to go to a doctor. When do you go to a doctor? Because so often you hear, oh, it's a virus, we can't give you anything anyways, rest fluids, but sometimes you need to go. Give me a guideline.
We're caught in this space where young mothers like you guys.
Thank you. I would like him. We tricked you.
I've raised your children in this era where we have all this rapid testing for viruses. But the truth is great, I'm going to tell you it's rhinovirus, or I'm going to tell you it's the flu virus. But the treatment is essentially the same for all of them. And if you Google them, they all have the same symptoms on there. Now, the flu actually does have a treatment. There is a treatment called Tamiflu.
Oh, yeah.
Okay.
But there's a caveat.
Yeah, you've got to take it within the first 24 hours or it's not going to do a whole lot for you, first and foremost. The flu treatment decreases the duration of illness by 1 day, but doesn't decrease your symptoms. So your child's still going to be sick for 5 days. They might just be better 1 day earlier. The place where it's really important is people with chronic medical conditions, people with serious asthma, chronic medical conditions. It can decrease hospitalizations. In elderly, it can decrease hospitalizations. So for those that have medical problems, that medicine works really well. For a healthy child, you got to catch it within the first 24 hours, and there are side effects associated with it, so a lot of families don't want to take that.
Well, not to bring it to a grimmer place, but being in your position as an ER doctor, do you see those severe conditions with the kids coming in with severe flu? I did, to answer your question, I took my daughter after she'd had a fever for 4 days, I was like, all right, this is too long. Let me just make sure she's okay. And I knew what I was going to find out. But are you seeing things in the ER as related to the flu?
At Johns Hopkins All Children's, we take care of the sickest children, right? So there are kids that are technology dependent who have tracheostomies. There are kids who have cancer that we care for. Those kids catching the flu is a really big deal for them. So yes, those families are coming in, and a lot of times we have to hospitalize those children because of that kids who have respiratory problems. For the average kid who comes in with the flu, it's supportive care, right? You're treating them with Motrin or ibuprofen or acetaminophen, Tylenol. You're making sure they stay hydrated. A lot of these kids don't want to drink very much, so if your kid is sick with the flu, make sure that they're drinking a sugar-rich fluid like a Gatorade, a Powerade, Pedialyte, something like that, and just that supportive care.
Thank you so much, Dr. Mularoni. We always appreciate
I love our
having you.
conversations.
Thank you.